thank everyone for coming today, but especially Ashley. Ashley Pickering Brown is the diabetic education coordinator for Emerson Hospital. So we're very lucky to have her here today to talk about diabetes, prevention, maintenance, all of the above. So Ashley, thank you so much for coming.
Thank you for having me. Thank you for coming on this really nice day, ladies. I know it's hard to be inside on a day like this, but so just a little bit about myself. So as Valerie mentioned, I work over at Emerson Hospital. I'm the diabetes educator there. I am a nurse by trade. I'm a nurse practitioner. I was a geriatric nurse practitioner for a long time and then ended up specializing in diabetes and endocrinology. So that's how I got here. Welcome, come on in. All right, so I like to give an overview of kind of what is diabetes, right? So a lot of people, even people who are diagnosed with diabetes, don't know what diabetes really is. So first we always talk about the normal. So what normally happens with your glucose, with your sugar in your body? So diabetes is a problem with that sugar, right? So everyone knows about like the high sugar. A lot of people say, I don't have diabetes, I just have a problem with my sugar. Probably you have diabetes, you know, they're one and the same there. So when you eat, your body breaks down food, and that food gets turned into sugar, which gets carried through your blood and gets turned into energy in your cells. And that's important. You know, sugar, people think of sugar as always a bad thing, but it's not. Your body needs that energy in order to survive. So the pancreas, which is that little organ right there, that yellow organ, it sits up behind the stomach. The pancreas releases insulin, a natural hormone that your body uses to carry the sugar from the blood into the cells. That's how your body uses it as energy. So diabetes happens when that process gets disrupted, when that insulin isn't used the way that it should. And so there are a couple of different types of diabetes. We're going to focus today on type 2 diabetes. That's the most common. I will touch base on type 1 diabetes just so you all kind of know the difference. But when that sugar goes from your bloodstream into your cell, that's the energy. That's how the body uses that energy. But when the body doesn't need the energy, when you've perhaps eaten too much sugar, that body turns that energy into fat. And that's how people gain weight and everything from eating too much. So in a person with diabetes, that process gets disrupted. Here, I like to point to all the pictures and stuff, but here, these are the blood sugars of someone who does not have diabetes, what is normal, and someone who has diabetes. I do take this with a grain of salt. Everybody has different goals. Depends on age. It depends on what else you have going on in your life. It depends on other illnesses you might have, might adjust these goals. So these are sort of the minimum, and then we go up from there. So don't be surprised if you have different goals from that. So that's not something to get too caught up on. But in diabetes, so we have that normal process, right, where you eat the food, gets digested, sugar goes into the bloodstream, insulin then carries that sugar from the bloodstream into your body for energy. In diabetes, that process is disrupted. So either your body doesn't make enough insulin, or your body is using that insulin in not an effective way. So these are just the types of diabetes. Touch base on these quick. You may have heard of type 1. It previously was called juvenile diabetes, but now we're seeing people older and older, even into their 60s, getting diagnosed with type 1 diabetes. Because there are blood tests we can do to check for type 1. The biggest difference is type 1 is autoimmune. So if any of you have kind of other autoimmune diseases like lupus or hypothyroidism, all of that's an autoimmune component. What that means is your immune system destroys something. Even though it's not supposed to. And so in diabetes, type 1 diabetes, the immune system destroys the pancreas and they can't make insulin anymore. That's the person you see who has been on insulin since they were a child. That's the typical type 1 diabetes. There is also gestational diabetes, which is diabetes that happens while pregnant. It usually resolves at the end of the pregnancy, but it can cause a lot of complications during pregnancy. Any questions about the types before we kind of dive into type 2 diabetes? And feel free to interrupt me at any point. So type 2 diabetes. This is 95% of people in the United States have type 2 diabetes. 95% of the people with diabetes have type 2 diabetes, excuse me. It stems from insulin resistance. So that's the body not using the insulin properly. So, and these are just made up numbers, but what used to take 1 unit of insulin now takes 5 units. It's like trying to fill a gas tank that has a hole in it. Your body just keeps producing that insulin to try to get your sugars down, but your body doesn't know how to use that insulin appropriately. So the pancreas just keeps doing it and doing it and doing it, and after years and years and years and years over time, your pancreas just says, I can't do this anymore. And your pancreas can eventually stop working. And that's when you'll really see diabetes kind of become out of control.
Can we have a bypass?
Sure.
Pancreas.
Yes. A pancreas bypass?
Do without it.
You cannot, no. I mean, you can, but you would need insulin injections if you had to have your pancreas removed, or if you had, some people with pancreatic cancer and things like that end up with they essentially have type 1 diabetes where they need to have those multiple insulin injections. Yes. And unfortunately, pancreas transplants aren't very successful because usually the same reason that your body kind of messed up the pancreas in the first place, it messes up the new one. So they're not we haven't seen a lot of success with those either. So that's what a lot of people want as well. So symptoms of type 2 diabetes. The big thing is often there are no symptoms. I don't know how many of you have or don't have diabetes, but often it's just found during routine blood work. You know, you just go in for a physical, you feel fine, they do blood testing and they discover the diabetes. So it's important that you're checked every year for diabetes, if not more often, even if you don't have any symptoms, because you don't want to discover that you possibly had diabetes 10 years before we even knew about it, because then it becomes a lot harder to control. This little guy over here, he's got, if there are symptoms of diabetes, which sometimes they are, especially if your sugars have been high for a really, really, really long time, you'll have some of these symptoms over here. Most common is that frequent urination and the thirst. You'll be really thirsty and want to drink lots of water. But we'll also see blurry vision, problems with the skin. That's another one that's common. If you go into your doctor's office with a skin infection, often they'll check you for diabetes to see if that type of infection has something to do with your blood sugar. Okay, so how is it diagnosed? It's diagnosed with a blood test. There are a couple of different ways. The first one is an A1C. You may have heard this term before. That's the most common way to be diagnosed. Normal is less than 5.7, prediabetes 5.7 to 6.4, and diabetes is greater than 6.5. The thing about diabetes, once you have diabetes, you have that diagnosis. We can certainly put it into remission and make it not an active diagnosis, but a lot of people will come and say, I'll say, how long have you had diabetes? And they'll say, oh, I just got diagnosed. But I'll look back and see, their A1Cs have been above 6.5 for a number of years. So once you kind of pass that threshold, we want to treat you like a diabetic, because that way we can get it under control as quickly as possible. All right. So it's very common. So maybe if you guys don't already know each other and you're fellow diabetics, you can make friends with each other, because it's often helpful to have support with your peers because you feel like you're alone. But in reality, diabetes is a big problem, which is good for me because I'll have a job, but not good for health. We want to keep everybody as healthy as possible. So 1 in 11 Americans have diabetes. And like I said, out of that group, 95% of them have type 2 diabetes. Type 2 diabetes is by far the most common. So there are risk factors. So there are what we call manageable risk factors and risk factors that you can't do anything about. For instance, being over 40 years old. You can't change that. Many people would if they could, but you can't change that. That's not a modifiable factor. You can't adjust that. But you can change, your blood pressure. You can change your lifestyle. You can change your BMI, which has to do with your weight. You can't change your family history. So there are certain things that cause diabetes that you can't do anything about. And you don't have to feel bad about it. Just focus on the things that you can change. And that's what you want to really kind of focus on. These are the complications. I'm not going to go through all of them because there are a lot and they're scary. But what I want to remind you of is that a lot of these complications we won't see until pretty far into diabetes. So it's important, as important as you can, to make sure it is caught nice and early. All of these complications come towards the end, and they come as people start to feel symptoms. They'll say, oh, I'm suddenly feeling numbness in my hands and feet. It's likely that that's been going on, leading up to it for a long time. So you want to make sure we catch this as early as we can. I do like to bring up a couple of things. Cardiovascular disease, heart attacks, strokes, things like that are more common with diabetes because that sugar, that high sugar, causes inflammation in your vessels, in your blood vessels, and that's what causes that increased risk. Additionally, blindness. Diabetes is the leading cause of blindness in the United States, and a lot of people don't know about it. So if you have diabetes, make sure you're getting a yearly eye exam, and make sure you're specifically telling your eye doctor that you have diabetes and you need to have a diabetic eye check because it's a special type of eye check. And I put the presentation in there so you can kind of look at this a little more detailed as well. Also, I just like to throw this in because this is kind of a hot topic with all the elections and stuff like that right now, but the cost of diabetes. It's very expensive to be a diabetic. People spend on average about $16,000 a year on diabetes medications, which is crazy. You know, and I'm working full time, and I could never imagine spending that much money. So it really is a staggering cost. So not only to the individual, but also to the government and to the hospital system and everything. And it really can add up. So as much as we can prevent diabetes, that's our goal. That's what we want to do. All right. So diabetes prevention. We'll start here. I'll put all of the things that a lot of people don't think about. Drinking water. It's a big problem with a lot of people. One of the physicians that I work with went on a mission trip to Bolivia, and tons of people were coming in having sugars in the 400s, 500s, so that's really dangerously high blood sugars. And she discovered everybody walked around with bottles of Mountain Dew. Nobody drank water. Everybody just drank soda constantly. And she would just say to people, just drink the water. And, it's important to point out, a Diet Coke doesn't count as a cup of water. A cup of coffee does not count as a cup of water,
Yeah. How about Gatorade?
Gatorade has sugar in it. So it depends on, there is sugar-free Gatorade. But I tend to think anything other than water doesn't count. Water is where you want to be getting most of your hydration. You don't want to be getting any calories or sugar from anything you drink, if we can avoid it, at least as minimal as possible. There's a lot of things up in the air about diet soda and like sugar-free lemonade and things like that. Certainly, I would say if you're diabetic, they're better than regular, Coke and lemonade, but there's lots of things about those fake sugars. Do they cause you to crave more sugar? There isn't any kind of definitive research on that yet, but I'm sure there will be. And I would almost rather you, if I have patients come in sometimes who say, I drink 5 cans of Diet Coke a day. And I say to them, I'd rather you drink 1 can of regular Coke and just sort of limit. I mean, obviously I'd rather you drink none, but if we have to balance it out. So it's all sort of a balance. If you every now and then have a Diet Coke, or every now and then have a regular Coke or a diet lemonade or a Gatorade, it's all about, you don't want to have that every day. You don't want that to be something that you're frequently having. Exercise, that's important. Some of the ladies were talking about that. As you get older, it's more difficult to exercise, but with exercise, it is often true, if you don't use it, you lose it. So it's important to make sure, keep moving, anything. It doesn't have to be, you don't have to go to the gym and do, an hour kickboxing class. That's not what you need to do. Certainly going out for a walk on a beautiful day like this counts as activity. Just keep moving, especially after meals, especially if you are diabetic. Walking after meals can really help keep your blood sugars in control. Weight loss. So weight loss sort of goes with that. Exercise, eating better, all of that. Even a small weight loss can make a big difference. There have been studies done that have shown a 5% weight loss is just as effective at preventing diabetes as taking medicine. And 5%, it isn't really, I think that's in my next slide actually. There, yeah. So 5 to 10% weight loss. If you weigh 200 pounds, that's 10 to 20 pounds. A lot of people get caught up in thinking, I need to lose 60 pounds, I need to lose 75 pounds, But it was shown that if any of you know anything about diabetes meds, the first line of drug is called Metformin. And they did a study of people without diabetes, and they put some on Metformin, put some on a lifestyle change that included this weight loss. And the people with the lifestyle change had a less risk of diabetes than the people on the Metformin. So it really goes to show you how important that weight loss is. We'll go back to that slide in a minute. But I do like to also point out cutting out the refined carbs and the processed packaged foods. A lot of people ask me all the time, what's the best diet? What can I do to, is it the grapefruit diet? Is it, it's the diet without packaged foods and without refined carbs, with whole grains. Those are the types of things you want to focus on.
Yeah. Does that mean a frozen food?
No. So if it's frozen and the ingredients, so say it's green beans, and if the ingredients say green beans, then that's fine. You just don't want to do like green beans with like a sauce tend to not be great, because it will have lots of salt and fat and all these things that you might not need. But certainly like frozen vegetables or frozen meat, things like that are just fine. Yeah.
What about these frozen smart foods or Weight Watchers, lean cuisine?
They're not great either. I mean, and again, it's all about like, what are we eating instead of? Are you eating, a smart diet meal instead of a Stouffer's meal? Then that's the better choice, right? But if we can have whole foods, that's the best choice out of them all. But sometimes that's what it's about. We all need convenience, right? I'm not saying I don't have a frozen pizza in my freezer right now. Like, it's all about kind of picking and choosing what's important and how to balance eating well, but also convenient and working in your life, which is really important too. And we're going to talk a lot about diet, don't worry.
It's also inherited.
Yes.
Because I know my grandmother had diabetes and my mother got it later on.
Yeah.
But before that it was Europe and they just died.
Yep, yeah.
Who knows
Nobody
how
knew.
before that, it was just Europe before that. But I get tested, I'm okay.
Yeah, good.
And my brother is okay, so I think it just skips.
And it could just be too, you can prevent, even if you have a strong risk, even if you have a lot of those risk factors, so a strong family history, age, overweight, you can do other things to help prevent that diabetes.
Not my fault, well, I don't even know.
Yeah.
And before that it was Europe, who the heck knows what, everybody they just died.
Yeah, and it's common. It's becoming, the problem is too, it's becoming more common. We don't know if your parents may or may not have had diabetes, we don't know. But it's becoming more common as we're getting to the younger generations as well. Yes, and it's true. That's a big part of it. Another part of it is watching the portion size. If you really want to eat those Cheetos, if you've been craving them for days, buying a little $1 bag of them, that's not going to harm you. It's when you have a bag of Cheetos every day or when you have that big bag in your house and you're eating them all the time. Things like that is what's going to get you. And quitting smoking. Quitting smoking literally reduces the risk of everything bad. So anyone who smokes, come talk to me. I will talk to you about ways to help you quit smoking.
My father just quit.
That's excellent.
Turkey.
That's it. And to have someone, your father, you said?
Yeah, well, he grew up in Europe and everybody smoked.
Yep. And to have someone quit after such a long time of smoking is a big deal.
Just stop.
Yeah.
And because my uncle was in the army, and of course the Lucky Strikes were in the K rations.
Yep.
But he said he really didn't. He said if anybody got hit, they stuck a cigarette in your mouth. But he said he really didn't smoke that much and just
Good.
didn't bother after.
Yeah, definitely. And if any of you smoke, come talk to me. We can work it out. But those small changes count. Again, a lot of people get it in their head that they need to go to Whole Foods every week and spend $800 on groceries. It's nothing like that. It's all just making small changes. That little bit, that 5-pound weight loss makes a difference. Tracking what you're eating. There's tons, if any of you have smartphones, there's tons of free apps on the phones. You can even just writing it down. Sometimes realizing what you're eating really helps. Watching your portions, actually measuring them with a measuring cup. I brought my little measuring cups to show you. It's important to see. For instance, this is a serving of rice. 1/4 of a cup is a serving of rice. Nobody eats this. This is insane. But it's important to recognize, when you have that on your plate, how much you should have. And even this is pasta. A cup of cooked pasta, not uncooked, cooked pasta. This isn't a lot. I know it's not a lot, but it's important. Doesn't mean you can never eat pasta again. It's just important to know how much you're eating and to take that into account when you're making the rest of your meal. Also, I like to point out reducing stress. Stress causes your sugars to rise. That adrenaline in your body actually causes your sugars to go up. So it's important. That's why in the hospital too, a lot of people will have higher sugars in the hospital because they've gone through some sort of trauma. So it's important. Take time out for yourself. Make sure you're reducing that stress. It will keep you healthy in a million ways and keep you healthy as far as your diabetes. All right. So now we've talked about the prevention. Now let's talk about diabetes. You have diabetes. Now what do you do? The keys are always going to be healthy diet, exercise, medication compliance, and blood sugar monitoring. So all of those, especially the bottom two, can come in a variety of different ways. You might not have to test your blood sugars at home, even if you have a diagnosis of diabetes. Depends on what medications you are on. It depends on what your blood sugars are like. All of that is individualized. So you might just get lab tests every 3 months or every 6 months, and that's how you monitor your blood sugars. Same with medication compliance. It is not a bad thing to be on diabetes medication. A lot of people think, I'm on diabetes medication, I failed. I can't control it myself. That's not true at all. It just means your body needs help. And part of the way we find the best balance is to put you on the right medications with the right lifestyle changes. They can't work independently. I wish I could medicate you and just let you eat whatever you want. My job would be so much easier if I could do that, but I can't. Even the best medications won't work if you aren't eating well and having a good lifestyle. I did also want to point out kind of your healthcare team. As a diabetic, you might not have all of these people. You might have people who aren't even listed, but make sure you know who you can turn to when you need things. You know, of course, you have your primary care doctor. They're sort of the epicenter, right? They take care of all your referrals, sort of organizing your care. Your endocrinologist. Some people have an endocrinologist with diabetes, some people don't. It's totally up to your primary care doctor, their comfort level, your comfort level with your primary care. It all depends, but they're the doctor who specializes in diabetes. A dietitian. I would recommend that everyone, even non-diabetics, should see a dietitian every year. Everyone should just check in, just to see how you're eating. A lot of people come to me and had no idea that they were eating poor. They thought they were making the right choices. And if, a dietitian can really help with that. A diabetes educator like myself, we're the ones who kind of teach you how to manage your diabetes and how to keep those lifestyle changes going. A health psychologist or a social worker. Diabetes takes an emotional toll on you. And if you have any sort of, depression or anxiety, diabetes can feed into that. Imagine, you're feeling depressed, so you eat that container of ice cream, then you have high sugars, which makes you feel depressed even more. So then you eat the container of ice cream and it's a big circle round and round. So it's important to keep everyone involved. Additionally, a pharmacist. If any of you have found a good pharmacy where that pharmacist really helps you out, it's important, definitely use that pharmacist. It's really helpful when you can get a pharmacist involved, especially with all the different medications and everything. Any questions? Am I going too fast? Yeah.
Doesn't diabetes itself cause depression?
So we don't know if diabetes directly causes depression. We do know people with diabetes have higher rates of depression. And we don't know if it's a physiologic, like a body change that causes that depression, or if it's just related to all the other things that go along with diabetes, like diet and stress and stuff like that.
It does skip generations. 'Cause
I've
I know
seen it, yeah.
My mother and my grandmother, before that was Europe, who the heck knows?
Yep.
My mother had it, and my grandmother had it. I remember as a little kid watching it with the needles. That's why I
Yeah.
can't look at the needles.
Well, hopefully we can keep you away from the needles.
But it does skip, because I
Yeah.
don't think I had a little bit, but I really don't have it. But my mother had it, and my grandmother.
Yep, yep.
So I think it does, and before that, they just died.
As long as you keep getting checked, that's all that matters.
She got it the year Banting discovered insulin.
So true or false, this is a group question, group participation. If I start taking insulin, I have to be on it for the rest of my life. What do we think?
Yes?
No,
No? We have some truths, some falses?
if you can control it.
It is false. So once you start insulin, so often by the time people start insulin, they do have to be on it for the rest of their life. That is true, because we as clinicians will try to keep you off of insulin for as long as we can. So by the time we get to insulin, sometimes it is the last thing that we can do. However, a lot of patients come in and they'll have really high sugars because they have uncontrolled diabetes. So we'll put them on insulin because we have no choice. We have to get their sugars down. But then they improve their diet, improve their lifestyle. We get those sugars down. And remember how I talked about the pancreas kind of giving up after it's been churning out all that insulin, it just gives up? If we bring those sugars down and we improve the lifestyle, the pancreas sort of, I joke that it's alive. It like looks around, it's like, hey, this is a much better environment. I'm going to start working again. And that's what the pancreas does, and it will start making its own insulin all over again. So a lot of people think, once I start insulin, like it's the end, that's it for me, and that's not the case. So that leads me into the type of medications. I could give you a 6-hour lecture on the type of medications for diabetes and we wouldn't even get through it. But just to briefly touch on them, there are pills. There are non-insulin injectables. These are the ones that you guys are seeing on the commercials lately about how I make my own insulin. And this drug's going to help me do that. There's lots of commercials about them right now. And then, of course, insulin. So we always start with pills. It's always the first thing we're going to do. It's safest, it's easiest for patients to take. The first line is metformin. Metformin is also often used for prediabetes as well as a lot of other metabolic disorders like polycystic ovarian syndrome and things like that. They can help women who are having difficulty getting pregnant. It's a good drug. So the good thing about metformin too is it's inexpensive and it's well tolerated. So that's another reason why it's always that first line of therapy. The non-insulin injectables, those are, if you've ever heard of the medications called like Trulicity or Victoza. These drugs are nice because they do help you lose weight. That's actually one of the side effects is weight loss. But they are very expensive. They're usually about $1,200 to $1,800 a month without any insurance. And then insurance coverage will vary from there. But if any of you have ever experienced the donut hole of Medicare, they'll only pay up until a certain point for your medications, and then there's what they don't call it the donut hole, they call it the coverage gap. And there's a gap in coverage. So, it's hard for us when we're thinking about how to best manage the diabetes, it's hard for us to balance wanting to give you guys the best medicine for you with wanting to balance out that cost and being reasonable, which is also sometimes why people end up on insulin. There are some insulins that are very inexpensive, some that are very expensive. Again, there's lots of things in the news lately about the price of insulin. But all of this is very, very individualized as to what will work best, what is going to be the best medicine, cost-wise, side effect-wise, ease of taking, all of that's going to be very individualized with each person. But, yeah.
If someone is diagnosed as pre-diabetic and they put on metformin, can that be reversed by diet and exercise?
Absolutely. Yep. So the goal of being on the metformin is to help prevent diabetes from developing in the first place, for sure. Any other questions?
Would you initially try other diet exercise before starting someone on pills
Yes.
for a while, and what would be like the range that you'd want to see?
So generally, that's a good question. So generally it depends on when we caught the diabetes. So let's say, I hope none of you ever do this, let's say you go 10 years without seeing a doctor, and we bring you in, you finally come in and we get you checked, and your A1C, that lab test that is 6.5 and up is diabetes, and your A1C is 10. We're going to immediately start medication because we don't know, have you had this diabetes for 10 years? We don't know. Whereas, let's say, which hopefully all of you are in this category, you see your doctor every year, if not more often, and we know from last year that you were not in a diabetic range, and now your A1C is 6.7, just slightly above normal. We definitely will give you a chance for diet and exercise and everything. We usually recheck every 3 months, and we want to see you either holding steady or going down in your blood sugars. If you start to go up, that's when we usually introduce medicine. Yeah. Any other questions?
On the exercise, any exercise,
Any exercise.
whether it's just walking or
But it has to be, one thing is true though, it has to be purposeful movement. It's not just, I every day at work, I walk this many steps. It's, I'm taking a half an hour walk purposely to get my heart rate up, get a little bit of, you don't have to sweat like crazy, but a little bit of sweat on the back of your neck. You want to feel like you have done some exercise. Having a leisurely stroll for 5 minutes, without raising your heart rate isn't going to really help as much. Certainly it's better than sitting on the couch. Again, it's all about comparison, but when we're talking about exercise, we do want you to get that heart rate up and to really, stairs are great. Yeah, as long as your knees can do it. What else is good? Swimming is great. Ellipticals, treadmills, bikes are great. Being outside, walking is great. Running, jogging, anything. Water aerobics, yep. Anything is good. Any movement is good. One thing I do like to point out, I don't know, which if you guys have diabetes, pre-diabetes, or just here to learn, but like I mentioned before, taking diabetes medication is not a sign of failure. It does not mean you are unable to control your diabetes, so you're a failure. It means that your body needs help, and that's what those medications are designed to do. They're designed to work with your body along with diet and exercise in order to make your blood sugars be in a normal range. It is also important to point out that diabetes is a progressive illness. So often, it will start and you won't need any medicine, but 40 years into the illness, by the end of it, you may need multiple pills or insulin. And that's just the normal, even with, even some people who are well controlled, that's just the progression of the illness. So not to think of yourself as a failure. So next we're going to kind of talk about diabetes management. Again, you have diabetes. How are we going to manage that? This slide looks familiar, right? It's the same. Diabetes prevention and diabetes management have the same aspects. Drinking water, watching your portions, avoiding those refined carbs and packaged foods, quitting smoking, exercise, weight loss. All of that feeds into diabetes management, so how to manage the illness. There is a little bit more with diabetes management. You do have to monitor your blood sugars. Again, whether that's at home or the lab is up to your doctor. You want to look at your feet every day, making sure no wounds or anything like that. Diabetics should not walk around barefoot. You should not walk around with unsupportive shoes. You should always have good shoes on. Taking your medications. That's really important. A lot of people, and this is where the cost comes in. So that's why it's important to work with your doctor and finding a medication not only that works, but that you can afford. And if you can't afford it, we got to figure out something else. And there's always too, I hate when people come, oh, I didn't take my medicine this month because I couldn't afford it. A lot of doctors will have samples or coupons. There's lots of things that we can do to help bring down the cost of drugs. So make sure and this is with any drug, not just with diabetes drugs, make sure you're always taking your medicine. And if you're having trouble, making sure you're talking to your doctor about it. Monitoring blood pressure and cholesterol. This is very important to have good blood pressures. So the goal right now is 130/80. That's a good blood pressure. Might be a little bit different depending again on age and any other illnesses you have, but a lot of people will say, oh, I'm fine, I'm 138/82. Technically, that's a high blood pressure. You want to be 130/80 or lower. And so we want to keep those blood pressures in control. And again, your goal may be different, so make sure to talk to your doctor about it, but that's the standard. And then yearly eye exams. As I mentioned before, diabetes is the leading cause of blindness, so we really want to make sure you're keeping up in your eye exams, making sure you're getting checked. Any questions about that?
How can we talk about numbers?
What, blood sugar goals?
Yeah, I have a problem that my children can't understand or recognize.
Okay.
If my blood stick came up to 200,
Yep.
why do I take insulin?
It will lower your sugar.
And if my blood stick came up to 70,
Yep.
why do I take it?
You shouldn't, depending on the type of insulin. So there are different types of insulin. If you're taking what's called short-acting or mealtime insulin, that's the ones you might take like 3 or 4 times a day. Those are based on your blood sugar, on how high or low your blood sugar is.
It's a 75, 25.
Oh, so that's a mix. Is that the one you're on? That's a mixture of insulin. You should still take it even if you're 70, because what will happen is that insulin works slowly over a long period of time. Because I assumed you take it with breakfast and dinner?
Yes.
Yes. So you should eat something with it, especially if your sugar's 70. You should be eating something with it. But that insulin is mixed with a long-acting and a short-acting. So if you don't take, even if you're 70, if you don't take your insulin, what's going to happen is you're not going to have any insulin in your body for the next 12 hours, which means in 12 hours your sugar's going to be 350 because you didn't take any insulin.
What about waking in the night?
What about it? For what reason?
That all of a sudden your eyes are funny and you're
So
sweating?
for like a low blood sugar,
Yeah.
that's
As low as 50.
That's too low, for sure. So that would mean you'd want to be talking to your doctor about the dose of insulin that you're on, because that means you're on too much insulin. Yeah, for sure. Especially if it's happening frequently. Every once in a while, it happens every once in a while, low sugars, especially to people who, let's say you unexpectedly that day were at a festival, and so you walked around a lot more than you normally do, and then for dinner you had, beautiful seafood and not a lot of carbohydrates, and then you went to bed. And so you not only exercised but ate healthy. Sometimes you end up with a lower sugar than normal because you kind of weren't sitting around and eating not so great food. So that combined can lead to it. But definitely if it's happening a lot, you'd want to talk to your doctor about getting a different dose. Yeah, it is crazy. Shouldn't be happening more than once a month.
Times when I can eat perfectly straight and I'll have high numbers.
Yep.
And another day when someone might come and I'll have something silly, like ice cream and all this stuff, my blood sugar will be fine.
Yeah. Unfortunately, diabetes is an unpredictable illness. We actually say, even in the medical community, that diabetes is an art, not a science, because sometimes there's just no way to know. But what you want to aim for is about 80% of the time, your sugar should be what you expect them to be, right? If you ate bad, your sugar's going to be high. If you ate well, your sugar's going to be in range. But then there is that window of error where, you don't know why something happened. But it's important to know how to deal with it, to know how to treat that low blood sugar or to treat that high blood sugar and kind of dealing with it appropriately. Yeah, but if the lows are happening a lot, you want to let your doctor know for sure.
I had a PBS, years ago, they did one of those bars of banting. And I still remember, they just used different animals to test it. A dog, because they had a big thing. The next morning, the dog was fine, and they knew. But they had a big thing, they couldn't publish. They used to get the dogs from the pound, you try it now, they'd want to kill you, the dog.
Oh, yeah.
But
You can't do
they
that
had
anymore.
tested on dogs. They were rescued from the pound.
Yeah.
And I still remember the scene the next morning, the dog was sitting there healthy as anything.
All right, so we're going to talk about diet.
They just said it works.
I know you have a lot of people, this is where a lot of their questions come from, right, is diet. So the focus is long-term change. So this is not all those fad diets, keto diets, grapefruit diets, juice diets, none of those are good. I will say some of them, probably none on this list, do have a place sometimes for kickstarting a diet. Sometimes people feel the need to make a dramatic change in order to sort of get going. And so in that place, a fad diet can sort of have a place for, maybe 3 days to get you going. But when we're talking about real change, it means having a healthy diet with all of the food groups, including carbohydrates. But you want those carbohydrates to be whole grains, healthy, whole carbohydrates. Have healthy fruits, healthy vegetables, and healthy protein as well. I have a little question for you. So, Dunkin's, right? Everybody likes Dunkin'. Which one of these has the least sugar? So we have a multigrain bagel, or a blueberry muffin, or 2 glazed donuts. What do we think? Don't we have a vote for donuts? Muffin? Bagel? All right, so we're all over the board here. All right, which is fine, that's good. So it is the donuts. 2 glazed donuts have the least sugar. Muffins, what I will tell you about muffins, they are cupcakes without frosting. So muffins are never a good choice. Bagels, because of their size, have so many carbs. So you can get the mini ones or have a half of a bagel, that would be a better choice. This doesn't mean I want you all to go out and buy some donuts. I'm sorry to break it to you. But what that means is it's not just about the sugar, right? So we think that we just automatically assume a multigrain bagel, But what if you really wanted those donuts? You'd be better off eating 1 donut. Don't eat 2, but 1. And a lot of people, again, think they're making that healthy choice with that blueberry muffin when, in fact, it's the worst one on this list. So it's important to really kind of understand what you're eating, and that's where this comes in. It's not just about the sugar. In everything that you eat, you want to have healthy carbs, healthy protein, healthy fats. That's what's going to keep your blood sugar from going all over the place. You're going to have a very different reaction if you're eating 2 glazed donuts, which are just pure sugar, right? Pure sugar. It goes into your stomach, sugar immediately gets released, your sugars spike up really high. Versus an English muffin with bacon, egg, and cheese. An English muffin is about 30 grams of carbs, which is a very reasonable amount of carbs. You have healthy protein from the egg, healthy protein and fat from the cheese, and protein from the bacon. Bacon has a lot of salt, so be careful. But, having that combination of all of these things is what's going to make it so when it gets broken down in your body, it's much slower and it takes its time, makes you feel fuller, and prevents that spike in your blood sugar. So I like this little chart because it shows you kind of the categories, right? So for instance, those carbs, basic carbs, grains, rice, potatoes, veggies, fruit. But see where the protein sort of overlaps with the carbs? Beans, for instance. Beans are an excellent source of protein, but they do have carbs. So when you're thinking about what you're eating, you have to take those into consideration. But I like this little spread of the chart. You should, in my opinion, in everything you should eat, you should have something from every single one of those circles, every time.
How is the Atkins diet with diabetes?
So it does work, but again, it's one of those diets that people aren't usually able to maintain for a long time. So it can work initially for getting people down. Atkins is a very, very low carb diet. Where I struggle with Atkins is I struggle with a diet that tells you can eat a bunch of steak, but that you can't eat an apple. I struggle with that type of diet because an apple has 25 grams of carbs, 25 grams of carbs, which is more than you're supposed to have in the Atkins diet each day. So any diet that says don't eat a fruit. You know, I have trouble with that. But it can be good for people who, especially people who come to me with really out of control diabetes. I will kind of guide them towards a very low carb diet initially, just to get them to a safe point. And a lot of people do what's called like dirty Atkins, or another diet is a ketogenic diet, which is a very low carb diet. They'll do like dirty keto, dirty Atkins, and those are basically the same principle, but you can eat an apple and a little bit more carbohydrates, and those tend to go over better long term. So the other thing I like to point out is that balance is important. So you're gonna have, again, a bowl of pasta with just marinara sauce on it. Your sugar's gonna spike right up. But that same bowl of pasta with some grilled chicken and some veggies with the sauce, you know, is gonna result in a completely different blood sugar, even though it's the same amount of carbs. So it's important. I like the kind of, they call it the plate method, right? You can see this plate has one little corner of grains, then healthy protein, and an entire half of the plate is veggies and fruits. That's what you want to be looking for. Most of the time it's the opposite. We have half the plate with carbs, right? The little corner with a little scoop of veggies and the protein down there. So you really want to make sure the veggies should take up most of the plate. And unfortunately, corn and potatoes are not a veggie. They are a starch, and they have sugar in them. So it's important to kind of keep that in mind. In the little books that I gave you, the healthy planning meals, when you open it up, on one side is all non-carbohydrates. So it's all foods that do not cause your sugars to rise. And on the other side are all the carbohydrates, just to sort of get a sense as far as what you're looking for and what you're eating. So I always say you should have something from both sides of that packet in everything that you eat. So even, for instance, an apple, you're better off eating an apple with a little bit of peanut butter with that protein in it, as opposed to just an apple by itself. Also, I like to use this moment to touch upon juice. Juice is no good. You're better off eating the whole fruit. Juice is just the sugar water that's left over from all the fiber. Think about a juicing machine, right? You have the front where all the juice comes out, and the back where all the fiber, all the roughage, you know, gets kicked out. Except when you eat an orange, as opposed to juicing an orange, you're eating that fiber. And so you're gonna have, it's much healthier for you. So you should do your best to avoid juice, unless of course like certain juices like cranberry juice, if you have a UTI, things like that can help, but that should be in the short term.
I just have a little bit of orange juice in the morning.
Yeah, that's okay. And it's okay to have everything in moderation. Doesn't mean you can never have a glass of orange juice ever again, but
Just take a
you know.
Why is it then that orange juice is what you take when you're feeling shaky?
Because there's a ton of sugar in orange juice and you want it to bring your sugar up. Yeah, so that's the kind of, we joke, low blood sugar is the only time we tell you you can have some soda or have some juice is when you're having a low blood sugar.
Healthy oil.
Yep, you can have absolutely olive oils, avocado oil. Canola oil is kind of iffy on whether, you know, people are up in the air about that, but it's not bad. But definitely the best are olive oil and avocado oil are the two best ones.
Grapeseed.
Grapeseed oil, yep, is another good one. Most, as long as they're fairly clear oils, it's when they kind of get darker that they can have a little extra fat. But most of the time, you don't want to deep fry foods ever. That's never good for you. But certainly putting a little of olive oil in a pan, you know, as you're cooking something is totally fine. Yeah. And it tends to give you healthy fats, which are good for your heart. Because even fats are kind of another word that we think are bad, right? But healthy fats are just as important, and they don't affect your cholesterol the way that we used to think that they did. So this is just an idea, just kind of a quick and dirty on how to do a nutrition label. So when you're looking at a nutrition label, you want to look at the total carbohydrates. That's what you're focusing on, not the sugars. I mean, the sugars are important, but you don't want to forget about those total carbohydrates, because in the end, it all breaks down into sugar. It all breaks down into the same thing. Generally, diabetics should have 150 to 180 grams of carbs a day. Non-diabetics are usually 200 to 220. Again, this will be very individualized and very tailored to you guys specifically, so don't get too caught up with the numbers without speaking with your doctor, but that's the most common, just so you can get a little sense of what you should be eating. And you know, if you think about it, it's a decent amount of food. A slice of bread generally has about 15 grams of carbs. So if you were to have a sandwich, for 3 meals a day, which you shouldn't, but hey, that's what you're doing, that's fine. That's 90 grams of carbs right there. So that leaves you with, a little wiggle room to add some snacks or to add, something else with this, have a couple pieces of fruit, things like that. I do like to point out that labels can be very misleading. So this says right on it, sugar-free, right? I have a lot of patients who come in, I don't know why my sugars are high, I ate sugar-free cookies last night. But in reality, it has 13 grams of carbohydrates. So in one cookie. So who eats one cookie? Nobody. So if you're if you're eating, 3 cookies, that's almost 45 grams of carbs. That's the equivalent of eating 3 slices of bread. And so people think that they're making the right choices. So it's just really important to make sure you're reading the labels and that you have a good sense of, of really what you're eating. Any kind of questions about diet? Yeah.
What about dark chocolate? That's supposed to be so good for you.
Yes,
but-
dark chocolate has a lot of good qualities about it. One of the best things is that it actually, because of kind of the bitterness and the sweetness, it makes you feel very satisfied with a very small amount. You tend to be able to just eat 1 piece of dark chocolate, 1 or 2, and then feel good and not want to eat more. Dark chocolate, out of the choices of chocolate, is the best choice. Ideally, that dark chocolate, what makes it even better is if it has like almonds or some sort of nuts in it, because that protein and that fat from the almonds mixed with the sugar with the dark chocolate is like the perfect kind of snack. But with that, again, it's all about the portions, making sure you don't eat too much. But it is definitely, out of all the chocolates, the best choice, for sure. Any other questions about that? I'm gonna have you going home now looking at all your labels, making sure you're eating the right thing. We kind of touched upon this for exercise. Any type of exercise is good for anyone, really. It's tailored to how you're gonna want to do it. And I don't want anyone, if you did this, that would be great, but I don't expect you to leave here and suddenly start working out 45 minutes a day, 7 days a week. Ease your way into it. If you don't do any exercise now, start taking a 5-minute walk 4 times a week, or a 20-minute walk once a week. However you need to spread that out is however works for you. So it's important for you to just find what you like. I have a young baby, so I don't have a lot of time to exercise. So when I am able to get away, I tend to exercise for an hour because I know that I might not exercise for another 4 days. So whereas you might have a little bit more time, so you might be able to do 10 or 15 minutes a day, and you wouldn't like doing an hour because you'd get bored. It's just about finding what's perfect and what's going to work for you guys, okay? And what's safe. So kind of to summarize, you have control over many of the factors of diabetes. Remember, we talked about those things that you can modify, those modifiable factors: weight, exercise, diet, stress, all of those things you have control over. And those are the things that make diabetes worse or can cause diabetes in the first place. So as much as possible, you want to be able to take control of that. And don't always view, if you get a pre-diabetes diagnosis or a diabetes diagnosis, thinking it's over. That's it. I might as well just eat all the cookies, who cares, and go from there. That's not. Use it as a motivating factor. Okay, I just got diagnosed. It's early in the illness. And you can say, I remember actually saying, if it's early in the illness, we can reverse it. Let me look at my diet, really have a good look at what I'm eating. Oh, I'm grabbing 3 of those sugar-free cookies every day. Maybe I should cut that out. Little changes. And then, like I said, eating the right foods, exercise, things like that. And it doesn't mean you can never have anything, good, anything that you really want that's tasty. It's just that those high carbs, so, it was summer, so I was dealing with a lot of people eating like fish platters, like fried fish platters, or Kimball's ice cream. Doesn't mean you can never have that ever. It just means don't buy a gallon and bring it home. If you're at Kimball's, get a kitty size, which is still bigger than any person should have. Get a kitty size, enjoy it, and move on. You don't have to feel bad every time you eat. Just make sure you're eating well most of the time. That's what you want to aim for. Any questions? That's the end. Yeah?
Is it possible then to remain in the pre-diabetic stage forever?
Yes.
I mean, if you just keep
Absolutely. And if for some reason you don't, it's not necessarily a failure on your part. It may just be that your body can't keep up with the demands. But definitely you can just be pre-diabetic and remain there for your whole life. It doesn't mean you're going to get diabetes. Absolutely.
But it does skip
It can. Sometimes it does, sometimes it
I
doesn't.
know
It
my
just
grandmother
depends.
had it, and then my mother,
Yep.
but I don't, or my brother. So maybe it just, and before that, it was Europe, and they just died.
Well, and you're very lucky, so that's good.
You just,
Yeah. Any other questions or anything?
I have a son, that, you know, we don't have diabetes yet. I have a brother that does.
Don't say yet. You don't have diabetes.
So, but he's under the idea that he doesn't eat sweets,
Okay.
cookies and stuff like that, and that he's gonna be okay.
Yep.
But yet I can't get him to eat too many vegetables.
Right.
You know, it's like, we have this running joke with broccoli and stuff. You know,
Yeah.
I'm always- if he comes up to visit, I'm always trying to force something on him. Like,
Yeah. And it's true. A lot of people will say, oh, well, I don't eat sweets. I don't eat cake. I don't eat cookies. I don't eat donuts, which is good. You know, that's great. But that pasta, that bread, you know, that rice all has the same amount of sugar as those sweet foods, unfortunately, right? So it's important to have that balance. It doesn't mean you can never eat rice or never eat pasta, but to make sure you're looking at the serving size and measuring it out. I recommend use these little scoops. I got them for free actually from like a company that visited the clinic, so I'll see if I can find them. Probably they're on Amazon. But you know, I'll say even like use these scoops as spoons. You know, don't use spoons. Just take that and scoop it right out, and then you know what the serving is supposed to be. They are small. Even myself, so I've been a diabetes educator for 5 years, and I've been dealing, you know, I've been a nurse even longer, and I had yogurt with granola, and I had just put the granola in a little container, and I track my food, and so I went to add it into the food, and it was like, oh, a half a cup, it was like 200 calories and 40 grams of carbs, something crazy. I was like, that couldn't have been a half a cup. So I changed it to a fourth of a cup. But then when I got home, I took the container and I poured the granola in it, and then I measured it, and it was a half a cup. And so even myself, who is used to teaching people about portions, you trick yourself into thinking what it is. So sometimes it can really be eye-opening to whip out the measuring cups and use that as the scoops on your plate to really see what's going on. A notorious example is cereal. People will say, I eat healthy cereal. Cereal is the Chinese food of breakfast. It is lots of carbs, lots of sugar, and nobody eats the right portion. You know, a serving of cereal is often a third of a cup. Nobody has that. Nobody. Sometimes it's a half. If it's like Cheerios is a half a cup, so that's not too bad. But this is nothing. You fill a huge bowl full of cereal. So, you know, really it's important to make sure you really are looking at those portions.
Where are you located if someone wanted to come and see you?
My card is in that folder. I'm over on Baker Ave. That's where my office is. Yes. So I see patients. I'm lucky enough I get to see patients outpatient and inpatient. Hopefully I never see you guys inpatient. I don't want any of you to be in the hospital. But I do a lot of diabetes education there, as well as for the nurses who are there to help them take care of diabetics better. And then I run the outpatient clinic over on Baker Ave as well. So, yeah, if you don't want it, that's fine. Or if you want to give it to someone else, yeah. Feel free to take extras too. I brought a bunch of them. So. That's fine. Yeah. And those are great like meal replacements when you're on the go, or even snacks. Those types of shakes are always good. They are a little bit processed, but again, it's all about picking your poison. Would you have gone to McDonald's? Have the shake instead. So it's all about what's the better choice. So any other questions?
Have you had any problems with people taking the metformin?
So you can have GI side effects, nausea, diarrhea, things like that. Generally, it tends to happen within the first week of taking it, and it should go away. If it doesn't go, and sometimes it can also happen if you forget a couple of doses and then have to restart it, but it shouldn't happen. There is an extended release version of metformin that can help with a lot of those GI stuff. So if you're having persistent GI issues, make sure you can bring that up, ask for the extended release. Yeah, and or we have to take you off of it. It's not reasonable to keep you on a medication that's making you not feel good. Because then you end up treating one thing with another. You treat the side effects with another drug that causes side effects. You don't want that.
What about Almacy? Do you know anything about it?
I do not.
It's in the diabetic magazine.
Oh, what is it called?
Almacy.
I don't know. Oh, I don't know. It's probably not officially approved. It's probably like a supplement. But I don't know anything about it, which is probably a bad thing. Like, it probably means it's not great if I don't know anything about it. So I try to stay up to date on that type of stuff. Yeah, yeah.
She said
Yeah, it's probably a bad sign. No, I don't know what it is either. Did you have a question?
Cover an annual diabetes screening if you have a family history of it.
Generally, it depends, at least once a year, and then certain plans will go from there. She asked about diabetes screening, if Medicare covers it, especially if you have a family history. Generally, they will cover it at least once a year, and actually a lot of plans on Medicare require it once a year. They require it for actually reimbursement for the doctor to make sure that they're following up and making sure that you don't have diabetes. So, and A1C is a very extraordinarily common test. I think even if you pay out of pocket, I think it's only like $40. It's not, $400 test or anything like that. But definitely it is paid for at least every 3 months. So, or at most every 3 months, I should say. At most every 3 months. And at least every year.
Thankfully, it's skipped, it
Yeah.
does skip generation.
Any other questions? Thanks, ladies. My card is in there. My card has my phone number, email address, anything like that. I have an amazing assistant named Kara. If you call, she loves to chat, so feel free to call and anything. Absolutely. Oh yeah, absolutely. And feel free if any extra materials you want to take is fine.